Hey everybody, welcome to Healthline. I am Gregory Zarian, and summer is still here. As I hope you are doing, that you are getting up and out, and you are going to the beach, you are going to the mountains, you are in the sun, you are wearing sunscreen, you're drinking tons of water. And we've spent the past 2 years on Zoom, on our phones, inside, just doing the best we can to take care of ourselves. The world is opening up. That still means you wash your hands, you throw on a mask when you need to. We are hoping that you are boosted and vaxxed and just being as healthy as possible. Get up, get out, get your exercise back on. You know, my mission here is for you to be as healthy as possible. And that also means having fun and learning things and doing it together. So today's really exciting for me. We're talking about a topic we never talked about. We spend a lot of time talking about the heart. Today we're talking about coronary stents. What is it? I'm going to let you know. So joining us from Adventist Health Glendale is interventional cardiologist, Dr. Hossein Dehghani. Welcome.
Thank you. Thank you for having me.
I'm so glad you're here because we're going to talk something I don't know much about.
Yeah, I think, coronary stents are probably an interventional cardiologist's best friend. And I'll tell you why. Because...
Oh, let me ask you.
Yeah.
So, Doctor, why is a coronary stent an interventional... Well, first of all, let me start... When we say interventional cardiology, what is that?
So cardiology has multiple different arms, and the way I usually like to describe it is the heart is a pump. So there's a pump function to it, which is the engine. Then it works on electricity that causes the beating, and that's the part that we go on to call electrophysiology. Then there is the plumbing, which is what they usually call interventional cardiologists, which is the coronary vessels that actually supply blood to the heart itself. And when you hear someone had a heart attack or had a coronary, they're talking about the plumbing. And the stents are essentially what interventional cardiologists use to unclog the vessels, if you may. And that's how, after we open a blockage, we essentially put them in to not allow for it to close again, if you may.
So you basically repair the plumbing of the heart.
Essentially, I'm a plumber.
Okay, you know what? Loving this already. We're gonna go, but in between now and the next break, as I always invite you to do some jumping jacks, do some stretching, have some water, get a carrot stick. We'll see you on the other side. Don't go away. Welcome back to Healthline. I am still Gregory Zarian. I hope you got some water. I hope you took care of yourself. And I hope you're excited to spend more time with me and my new favorite plumber from Adventist Health Glendale, interventional cardiologist, Dr. Hossein Dehghani. Doctor, first of all, I love that you gave it that analogy. And sometimes what's really important to me here at Healthline as the host is to break our topics down like you would to like a 5-year-old. Just because when you think of a heart, you think of the aorta and how much pumping and all these words, but when you think of the plumbing and the replacing or the repairing, I feel that works for all of us.
It honestly allows me to communicate the concept a lot easier, and that's how I honestly look at it.
I love that. What got you into interventional cardiology?
My father actually had a heart attack and unfortunately passed from it.
I'm sorry.
And yeah, me too. He was quite young, in his 50s. He was also a physician, very hardworking. Kind of a stressful physician life. And unfortunately, at the time, they didn't know enough about smoking, so he was a smoker. And he had a massive heart attack and died from it. And I think that really left an impact on me and made me want to do something so that hopefully I can prevent that horrible feeling that I had as a young man of losing my father for hopefully many other young people, families. I said, well, let me go and see if I'm any good at this, and maybe I will do that.
So this is personal to you?
Very personal to me.
I love that. So here's to all the fathers out there, and so what's your dad's name?
It's hard, but Faraj.
Okay, to Faraj and to my dad, Loris.
Yes.
Hi guys. Thank you for sharing that.
Sure thing.
I just want to share with us some of your medical history, because then I want to back up a little bit.
So I've moved around a lot in my medical training, but I went to medical school in Thomas Jefferson University in Philadelphia. After that, I did my internal medicine residency at Beth Israel Deaconess, which is one of the Harvard teaching hospitals in Boston. From there, I went to New Orleans and did my general cardiology fellowship at Tulane University Medical Center. And then to do my interventional cardiology, I went to UCSF in San Francisco, and I finished in 2013. So it's almost 9-10 years that I've been out.
That's a lot of heartbeats.
Yes, that's a lot of heartbeats.
Let's start. I really want to dive into the process of a stent who is in need of a stent and all that. But you said something about smoking. Because I smoked 2 packs a day for 20 years. And my father, his dream was to see me as a non-smoker, and he got that.
That's wonderful.
It was the hardest thing I've ever done. And he would always say, why would you let something so small be so big? And I say to anyone that smokes, and you know who you are, going and picking up a cigarette and lighting it is a choice. Not picking up a cigarette and not lighting it is also a choice.
Correct.
What do you, because you see this all the time.
Yes.
And I hate to be so transparent, but people die every day from smoking.
They do.
What do you say to people that smoke?
I usually, I think I've been a doctor now for 14, 15 years. So I think over the years, how I've tried to open the discussion has been very different, because when I was much younger, it was more like, this is bad for you, you need to quit, right?
Sure.
But as I've gotten older, I think that I try to acknowledge the fact that quitting smoking is not easy, but it is something that everyone needs to do this as soon as possible. And no matter how addicted you think you are to this highly addictive substance,
of course,
you have to wake up every day and try to move forward in that plan. And you need to realize that, yes, many people quit and start again and quit and start again, but you look around and a lot of people have successfully done it. So there's a lot of different ways to get there, but there needs to be a plan, and you need to do your best to stick to it. And it can't be an indefinite plan, right? So I tell most of my patients, the most you're allowed is 3 to 4 months, but you need to commit to this, and whatever the plan is. There are pills that people can take that curb the craving. There are gums, patches, lowering the number you smoke, and associating with people who don't smoke. I think that's the biggest thing with smokers. They happen to have their smoking buddies. They happen to have it in the office. They happen to have it,
well, it becomes
at
your
home.
ritual.
They find a ritual. So it's breaking the ritual. It's breaking the cycle and changing the way you go about your habits. Chewing gum, there are many different ways, and I think for different people, different modalities are successful. But I think it's committing to a plan and trying not to diverge from it is how I try to at least have a plan. So when I finally get to an agreement with a patient that they are going to quit, which is honestly half the battle, then I actually make them come and see me very often. Because I want them to check in.
You make them accountable.
I make them accountable, and I want them to check in, and I want them to tell me if it's not going to plan, why it's not going to plan, so that they can hear themselves make the excuses, get over that, and then come up with the continuation of the plan.
It's never too soon. I love you. So you know what your excuses are. I know what they are, because I did them for over 20 years. Bottom line is, smoking can possibly kill you, period. When we come back, we will spend more time with my new favorite plumber, Dr. Hossein Dehghani, and share with you what a stent is, who could use a stent, and what happens if you've had a surgical procedure that involves a stent and what the recovery is, and also share with you great ways to just turn your lifestyle into a healthier easier way to live. More when we come back. Don't go away. Welcome back to Healthline. I'm still Gregory Zarian. Joining us from Adventist Health Glendale is my favorite interventional cardiologist and plumber, Dr. Hossein Dehghani. Doctor, let's back up a little bit. Refresh us real quickly about what a coronary stent is and who's actually in need of one.
So a coronary stent is made out of metal.
Okay.
It's usually platinum or chromium, something that you wouldn't be allergic to.
Would it be this? A lot
It's
smaller.
smaller than
Okay.
that. They range from about 2 millimeters to 5 millimeters
Okay.
in diameter. They are essentially probably the most influential discovery in interventional
that.
cardiology that allowed for us to be able to pass a blockage in the vessels of the heart, the coronaries, open them up in the with balloons. But what used to happen is they would recoil and recoil pretty quickly, and people would continue to have the same problems that needed a stent. Once we had these stents, which have gotten much better over generations, they actually essentially don't allow for the vessel to recoil and close and give us a much better success in long-term patency of the vessel.
So people don't have to come back and redo
Exactly.
the stent.
So they don't need to come back and get more work done, and allows for them to have a much better lifestyle without what we call angina.
Do you see more men or more women?
I would say that it's probably still more men than women, but that number and gap has closed over the years. Now, particularly in Glendale, I would say that I see a lot more men. But when I've been in other places, including the San Francisco Bay Area, it was pretty close to 50-50. I would say in Glendale, in my experience, it's probably about 70%, 30%.
Okay. Signs and symptoms of heart attack, what is it?
So signs and symptoms of, let's say, coronary blockage can range from very basic, mild pain and pressure. When
This is for men and women,
For
yes.
men and women.
Okay.
When you try to do activities, right? And usually what, alarms me that this is more likely to be from the heart than other things like indigestion or musculoskeletal pain, is that it's pretty reproducible with the same level of activity.
Okay.
Right? So if going up a flight of stairs gives you this uneasy feeling, because it's from a physical blockage in the plumbing, the same level of activity should give you the same alarm. So if you get it once every 3 weeks and the other times you can run up the stairs, it's unlikely that it's actually from coronary blockage.
Okay.
So it's pretty reproducible. Now this
But if somebody's going
yeah,
up the stairs and it is consistent,
then
that
that's
means-
very alarming.
Okay. But if there's a
right?
one-off per se,
Yes.
or every couple of weeks,
And it goes away pretty quickly, then it's less likely
Got it.
to be a cardiac source. Now, this has a range because you could imagine if something is 60% blocked versus 90% blocked, the intensity of the pain and the duration will become more and more prominent over time.
got it.
This is called angina-type pain, which is different from a heart attack. In the event of a heart attack, there's either a full blockage of the vessel or a plaque buildup has now ruptured and the flow of the blood past the lesion is now limited. That begins to actually cause damage to the heart muscle, and the intensity and the pain continues to ratchet up to where you feel like an elephant is sitting on your chest. You can barely breathe, you're sweating, and you just feel this doom that something horrible is happening. So that is the difference between angina, where the blood flow is still okay, but limited, whereas a heart attack where now there's a problem with the flow altogether, so a part of the heart muscle is actually going to begin to die.
So bottom line is, if you feel like an elephant is sitting on your chest, or you are going upstairs or walking to your car doing something that you usually have done, and it becomes impaired, that means make an appointment and go see your cardiologist.
And if the pain is ever more than 15, 20 minutes and it hasn't resolved, don't do the Glendale thing of going to sleep and see if it goes away. Please come to the emergency room. The number of people who said, I had this, and I said, let me just sleep the night and see how it goes, and then end up in the emergency room at 4 a.m. And now, unfortunately, they're 3, 4, 5 hours into their heart attack. is significantly higher than it should be.
Well, because with stroke, time loss is brain loss.
Yeah, and
with
with heart attack, same thing.
Same thing.
Yes.
And also one thing too is don't Google everything, because that sends people into the rabbit hole in a spiral,
Exactly.
and you self-diagnose. So doctor, somebody ends up in your operating room.
Yes.
They need a stent.
Correct.
Can they get more than one stent at a time?
Yes, I think the most I've ever done is 13.
Oh, goodness.
In
Okay.
one sitting, because that was a true emergency where all the vessels in a particular person had ripped. A different situation,
Sure.
but for which stents also they can again allow for you to tack up things, whereas before nothing could have been done. But generally speaking, I think most people who end up getting stents end up with one or two in one sitting, and this has to do with, again, the diameter of the plumbing. Think of it as different, thickness and inches and length of the lesions. So, you need to essentially pick the right size and the right place and be able to deliver these around bends and all the things that are very different in different people.
More with Dr. Dehghani when we come back. Don't go away. Joining us today from Adventist Health Glendale is Dr. Hossein Dehghani, interventional cardiologist, and what have I said? My new favorite plumber. So doctor, someone is on your table, someone is having a stent put in. What is the procedure like? And then once you've completed, is it laparoscopic? Is it where you actually open the chest cavity? What does this look like?
I obviously consider it pretty basic, but to someone receiving the procedure, it's anything but.
Because I'm sure people think, well, I'm going to go in and have heart surgery.
Yes, and they
it's
always
scary.
think they're going to have these big scars and everything like that. But in reality, angiography has come a very long way. At this point, I would say 80-90% of the people, we actually do the case through the radial artery. So if you put your hand here and feel your pulse.
Does it matter which arm?
No, not really. Okay. I go from the right because I'm right-handed. And you see, and exactly where that pulse is, we put the smallest little catheter in there, which is 2 millimeters in diameter. And we go all the way up to the heart, do whatever we need to do plumbing-wise, get out, and they end up with a little wristband that stays on there for an hour or two, and then we remove. There, honestly, after about 2 days, it really just looks like a mosquito bite. Now, in some people who have very tiny arteries, we have to go through the artery in the groin. And that's still the same size equipment, but then for them, the recovery involves a couple of days of no heavy lifting. We don't necessarily want people to drive right away after, mostly because if you have to slam on the brakes all of a sudden, that could make the little suture in here pop. So if you go from here, just no lifting for 1 or 2 days so that you don't end up, making the wrist bleed. But we even tell our patients, if you see any bleeding, hold it right here because it's very easy, and just have someone call us and we'll tell you what to do. So the recovery is really...
And this is the same for men and women?
For men and women.
And so there's no going to the chest?
There's no scars, there's none of that.
No chest cavity, you think?
Nothing.
Okay.
And it's not done with general anesthesia, it's done with sedation, which, if anyone has had a colonoscopy or anything like that, you're kind of in this dazed state, and a lot of people, honestly, at the end of the case, are usually asking me, when do we start? So I think it's not a bad experience, but I've never had one.
But I want to say one thing, though. It sounds like it's such an easy experience. That does not mean, though, I can still smoke, or I can still be unhealthy. Or it doesn't give you a free pass because you think, I can do this and be in your office, and boom, it's easy, and I'm going. No, it still means you have to be as healthy as possible.
And not only that, if you do happen to get a coronary stent, you have to make a commitment to try to keep that stent open, okay? And because if you don't...
It's more vulnerable to recurrence,
yes? You are more likely to need more and more work. And imagine having a stent, now putting another one inside it to open that, and a third one, and everything has its limitations. Not only that, at that point, if you have gotten a stent, you now really have to commit to a healthy living and a commitment to taking the medications, because the stent is made out of metal. It takes about a year for it to get covered with your body tissue. In that year, you do have to commit to taking medications that make sure this metal doesn't develop clots on it. Things that make stents close pretty quickly, the most egregious one is stopping your medications. In about 3 to 4 days, the stent will clot, and you'll go on to have a massive heart attack. Smoking will make a stent close off much faster. Having high cholesterol, having diabetes, inactivity. So in a sense, it's just like not having the stent. But I feel like it's a commitment that I have made to my patient to put them through the procedure, to put a stent in them. And if they don't take care of it, you know, I don't know. It almost feels like one of us broke that commitment.
I love that you keep on saying we made a commitment, because you as a doctor, I'm committing here to take care of you. So I
Exactly.
need you to commit back to me
Yes.
that you will take care of all that I'm doing.
All that I'm doing. And not only that, I'm putting this stent in you, trusting you that you are going to do the right things, because otherwise this stent will go down. And tomorrow I have to sit there and wonder, did I do something wrong that this stent went down? And, you know, was it not the right size? Was it not picked perfectly? Did I not give 100% of myself to you in that procedure? What happened? There's a lot that goes on with us that people don't necessarily see.
Well, people think once you do a procedure,
Yeah.
I am healthy, am I free and move on.
Exactly.
Same
And-
thing with physical therapy and all of it.
Exactly. Like with everything, you know, if you buy a brand new car and you never change the oil, eventually in about a year, there will be nothing left of it.
But then
And
people are going to blame
exactly 1,000
Mercedes.
things, but
You know
yes. So you have to commit to taking care of your heart and your body. But, you know, I do honestly think that it's a bi-directional commitment. Like, you call me, I call you right back and tell you what to do. But please do the 3 things that I'm asking of you. And I'm really just asking of you to take care of you. So, you know, I think that's a very important thing, that, you know, if I come to the hospital, it's 3 in the morning, you're having a heart attack, I bring a whole team of people, wake them up to come there to take care of you. At least, you know, give us this prize back of seeing you well and healthy 2 years down the line, because that's what gives me motivation to keep doing what I'm doing.
and in honor of your dad.
Yes.
Since we're already wrapping out, in 5 to 10 seconds, what do you invite us to do to have a healthy lifestyle? Diet and exercise.
So,
Eating and exercise. I don't
Yes.
like the word diet.
so I think the most important thing is, you know, exercise, which for my patients, since they've had some problems with the heart, I don't want them to become marathon men overnight. So I just say, get out there and walk. I think because all of us can usually do that. And I would like for them to start by just walking 10-15 minutes at whatever speed is acceptable to them. And then just build on that to hopefully get to about 30 to 45 minutes 5 times a week. That's our goal. Now, people who can do a lot more than that, I think, you know, because most of my patients are older, and I don't want too much impact on their legs. I don't necessarily want them to run unless they like running, but I think cycling is very good. I think if they have problems with their weight, getting in a pool and doing any kind of exercise is great. But it's really multifaceted. Eating healthy definitely helps. You know, we can get into the whole what is the best eating modality and all of this. But I think the Mediterranean diet has consistently shown to be the best for, you know, long-term cardiovascular health. So I try to, you know, tell them to look into it. And I think, you know, it's a very delicious cuisine, and it has a big range of tasty food. So it's not like you're committing yourself to having things that are not, you know, a pleasure to eat, because I do think that, you know, eating is pleasure, and we should be able to eat things that make us happy. But, you know, within every cuisine, you can find things that are better for you, and then learn how to prepare them in whatever way is more delicious to you without it being detrimental.
Thank you so much for being here.
Thank you for having me.
Wow. So you heard it from Dr. Dehghani. Don't end up in his office. Don't take for granted the commitment and the agreement your doctors make with you. It is a team effort. So be part of your own team. Remember, the most important conversation you are going to have is about your health. So start talking about it now. We'll see you next time. Take care and be well.